That team is comprised of two people and a clinician, either a social worker, a registered nurse, and their goal is to go out and to try to get people help, especially if they have history, try to get them into hospitals to get them help instead of going to jail.
You know, we are a clinician and law enforcement officer in partnership to not to arrest anyone, but to make sure that the person in crisis gets the help that they need, the proper help and the proper treatment. You know, we are especially trained for this specific team.
We get a wide mix of calls. We get folks that are under the influence of drugs. We get folks that are truly mentally ill. We get folks that are just having a bad day and just need to talk to someone and get a little bit of crisis intervention.
Or sometimes that person that we go up to is really agitated and doesn't want to speak to someone from Department of Mental Health and feels a lot more comfortable talking to an officer who's able to actually de-escalate the situation so that later they would feel more comfortable talking to myself. It really feels a lot better to have that law enforcement officer with you, because even if you're going to a call where the person may be suicidal, depressed, that call can easily change into someone who's homicidal. Law enforcement, they're trained to a large extent of de-escalation, you know, and I think that's a big part of going into calls for service, you know, and as a clinician by yourself going into it, that I would not feel safe, I would not feel comfortable.
And it's a proven model. It's been around for 26 years in the city of Long Beach, and it's proved to have saved a lot of lives, helped a lot of people, and I think it's a model that everyone should have.
And we bring a lot of understanding, a lot of patience, a lot of kindness into every call that we do. And we're only here to do good. I
love the work I do. My biggest reward is when we respond to a call and a parent or a family member says that we have helped them, helped their family, and their family member is doing well. It's the best.
And honestly, this is like the best job I've ever had. Yeah, it's the most rewarding job. I've never been in a job where I've gotten so many compliments as to how we work together, how we were able to help families and continue to help families because of us following up and making sure that the person is still safe, the person is still getting mental health services. You know, just hearing that that someone's gotten a lot better just because we were able to help them is the best thing that you could ever hear, the best feeling you could ever have.